Hello, my name is Andrew, and today be presenting on wound care, specifically home wound care, the kind of wounds that you take care of at home and with loved ones, the kind that, you fall down on the street, you scraped your knee, you got scratched by your cat or dog, uh, you fell on the floor and scraped your arm on something, the simple stuff that you can take care of at home and does not require medical assistance. But more specifically, I'm going to talk about two products, common household products that in the past have been commonly used and promoted. But in the recent years, five-ish years, uh, the health industry is kind of turning around their perspective on that. Much of the information I'm going to be providing today is coming from the Ohio State Health University, the UCI Health, the CDC, a few others, but just to highlight that recommendations have been changing on how we approach wounds, uh, and especially on these two products that I want to talk about today. Today, we're going to be going over hydrogen peroxide and neosporin. And I'm sure some of you have these in your house right now. If you don't, great on you. But Andrew, aren't these common for a reason? We've got an antiseptic, we have an antibiotic protection. What's so bad? Well, it's not necessarily that they're bad, they're just not that good. Studies have shown that both these products are no better than just using soap and mild soap, fragrance free, and water, just simply washing and adding a protective layer, which we'll go over in a little bit later. Uh, so think about when you last used hydrogen peroxide, or even watched someone use it. See them pour it over, it turns white, it bubbles, and it fizzles, and then it burns a little bit. It's a little painful. Yeah, that's it working. Uh, but the problem isn't that it's not working, because it's working. The problem is that it's working too good. And what do I mean by that? So hydrogen peroxide is acidic, uh, and what it does, it goes through a process when you apply it to the wound bed, that's oxidative. And what happens when it's oxidating is that it's essentially poisoning all the cells in the vicinity that it touches with excess hydrogen. Excess hydrogen is poisonous to these cells. They can't survive with it. They can't resume their cellular respiration when they have too much hydrogen. So they just die, which is great, right? Pathogens, we want them dead. No infection. Well, yes, that is good, but we could just wash them away with water and soap without harming our own cells. Our own cells. Hydrogen peroxide is also killing our own cells when we apply it on the wound bed. And if you kill those cells, it takes a lot longer for it to granulate or create healthy new tissue to replace what was lost. Uh, so this oxidation that's destroying our own tissues is delaying the healing process. Uh, so it will heal. It's just we're delaying the healing process. Do we want to do that? Most of the time, not really. If you want to have it healed quick and fast, just wash it with some soap and water, non-fragrant soap. Uh, make sure everything's mild. You don't need extra dyes. Mild soap, warm water, Much better at cleaning out wounds than hydrogen peroxide. It's much safer uh, and much more tissue friendly. Okay, but we still want to prevent infection, right? So you washed it and you're like, well, let's throw some neosporin. Got to make sure that we're preventing any pathogens from infecting our wound bed. Well, neosporin has antibiotics, typically more than one. It's got three. Uh, but the issue we're having with neosporin is that there hasn't been any studies that are showing that it's any better at preventing infection than just having a clean wound bed that has uh, applied like a petroleum jelly that like Vaseline or Aquaphor and a Band-Aid. Like that works just as good at preventing infection as Neosporin, if not better. Uh, and there's a few reasons why it's better, which I'll talk about later. But why is so what else is not good about Neosporin? Well, it's also being shown that, according to the UCI Health, uh, roughly 5 to 10% of people are going to experience localized allergies symptoms to that area. Not exactly a helpful thing, especially when you're trying to figure out if it's being infected or not, when it's trying to prevent infection. If signs of infection, you're going to see redness around there. It's going to be swelling. Those are also the same signs and symptoms of allergies. So it's kind of like a confusing thing that can happen there. So, what can we use that's better and has been shown to be better? So, what I mentioned earlier, we clean the wound bed with water and soap. We then we apply a thin layer of either petroleum jelly, whether it's Vaseline or Aquaphor, because those are purified. Purified petroleum is what you need, not just any petroleum jelly, purified. Uh, and have that covered with a Band-Aid because we want to keep a moist bed. So studies have shown that a moist wound bed is going to heal much faster than a dry wound bed. Tissue needs a moist environment to promote healing. Along with that, for people who don't like to have scars, uh, keeping a moist wound bed as it's healing with that Vaseline and like that covering or using a hydrocolloid dressing is also going to reduce your the scar tissue. So any visible scar tissue is going to be reduced. That scar is going to be much smaller. It's also going to heal loads faster. Something that would take a week to heal would only take maybe half the time if you cleaned it as mentioned, and if you use a nice moist uh, environment. So to review, we have hydrogen peroxide, not recommended. Wash with just simple water and fragrance-free soap. Two, we have Neosporin or antibiotic cream. Not recommended. It doesn't really uh, prevent it doesn't prevent infection any better than just having a clean wound bed that you've covered with a moist environment, whether it's with a jelly or a hydrocolloid dressing. Uh, and to remember that while I'm giving all of this information, that you should still seek medical advice if you have wounds that are uh, deeper than an inch, whether it's like a puncture wound, as in a bite, or you have a large enough wound that you don't have anything that can cover it adequately. So again, or you should go if it somehow does still get infected. Which the signs of infection before I leave you, if you see redness around your wounds, If there's any swelling around the wound that is accompanied with pain, we don't want any pain. And then if there's any foul smelling smell or any colored exudate, which could be either white, yellow, or green, those are pretty big signs of infection. You need to see a doctor. Uh, and with that, thank you for your time. Stay safe out there.